Good morning. Great to see everyone here. Thanks for joining us today. Just wanted to share a few thoughts and words with you. You know, when I joined the Idaho Food Bank 10 years ago, I was instantly honored and impressed to be able to be engaged and involved with such committed and creative and devoted people like yourselves, who see people who have a need and do amazing work to meet those needs and provide that level of support. I knew right away I better step up my game in order to keep up with the fascinating and really impressive work that's being done across Idaho and our communities. It's also really important to see the evolution that we've made, and many of you have been involved in this line of work longer than I have, or some of you maybe more recently involved in this. But it's not a static kind of work that we do. It isn't always the same, and it's interesting to look at that evolution over the years. And I remember our initial focus was on how many pounds of food are we distributing? It's all about pounds of food. How many pounds of food are we bringing in? How many pounds of food are we getting to you? And that was an important metric because we needed to get the food to the people who were struggling with food insecurity. That evolved to a focus on what type of food are we providing? Is nutrition important? We need to look at that focus on nutrition and nutrition education. And I remember having some pretty interesting discussions with my board of directors, and they wondered why it was, what? We're about food. But it became necessary, it made a lot of sense for us to be able to not just focus on pounds of food, but focus on that nutritious food. And that evolution has continued within our industry to what I think is a really exciting place, and what brings us together today to talk about community health. And what does that mean when we say that phrase, community health? And who are our partners, which brings even more people into the room today and into our conversation because we have a shared goal. We want to help people stay healthy or get to that healthy place. Food obviously has an important part in that process, but we can't do it alone. We know that. You know the partners that you have in your communities and those that are necessary for your people to be able to work with. And what's really encouraging is the like-minded awareness and desire to partner from various organizations. One of the key leaders in this effort, I have the pleasure of introducing today Dr. Ted Epperly. I've had the opportunity to work with Dr. Epperly for a number of years now and continue to be in awe of the brilliance of this man and his ability to communicate what that important message is and make it relevant for all of us. And I know you're going to feel the same way after his presentation this morning. Let me tell you just a little bit about Dr. Epperly's background. He is the president and CEO of the Family Medicine Residency of Idaho, a federally qualified teaching health center comprised of 8 FQHC clinics, 4 ACGME Family Medicine Residency programs, and 4 fellowships. I think he doesn't sleep. I'm pretty sure there's not time. He received an undergraduate degree in biology and anthropology from Utah State University in 1976, graduated from the University of Washington School of Medicine in 1980. I might not cover all of these key facts, just it's impressive. He's a current member of the ACGME Board of Directors, has responsibility for all residency and fellowship training for over 125,000 residents and fellows of all specialties in the United States. So when we talk about healthcare in Idaho and access to healthcare in Idaho, this man has close, intimate knowledge of what that means, where our challenges, where our gaps are, and is working to make those improvements in our state so that we have the access that's needed. He currently serves as the governor-appointed chairman of the board for the Idaho Healthcare Coalition that is in charge of helping transform healthcare for the state of Idaho. His multiple award-winning book, Fractured, did we have a copy today? Dang, I should have brought my copy. You need to get a copy of this book. Fractured, America's Broken Healthcare System and What Must Be Done to Heal It. It provides an excellent insight into the U.S. healthcare system, and it can be found on Amazon.com. And truly, it is an excellent read. there's a lot of intricacies in understanding healthcare system in the United States. And I know when I started working with Dr. Epperly on some of these issues, healthcare is not my background. There's a different language, trying to understand how does this work, how does this fit together, where are those disconnects? That book really brought to light for me those aha moments of, okay, now I get it. I see where we have those issues. So I highly recommend that you pick that up and read that. So without further ado, Dr. Epperly, I would like to introduce you to our amazing audience here today.
Well, it's really an honor to be with you. I was born in Nampa. I was raised in Caldwell until I was 10. My family moved across the state to Idaho Falls, where I graduated high school. So I'm born and raised in Idaho. And after 30 years away, college, medical school, 21 years in the United States military, I came back to Boise because I love our state. And it's a state in which solutions can be found to problems. I can't imagine how difficult issues are in California and Texas and Pennsylvania and elsewhere, where at least in our state we know each other, we work with each other for the common good, and I like that. You know, one thing that I would just say in hearing Karen open up and Jackie's comments is I'm reminded by a quote from Confucius. And Confucius once famously said, and you've heard this, but you give a person a fish he eats for the day. You teach a person to fish, and they eat for the rest of their lives. So much of moving upstream towards better health is engaging our people in their own education around their own behaviors. We don't need fancy downstream healthcare for most things. We need appropriate upstream education to help people learn to fish. And so one of the key messages I'm going to share with you is that message. We're all in this together. And trust me when I tell you, the solutions to these problems aren't going to be found in the healthcare system. That's a totally different system. It's a business. Where the solutions are going to be found to these issues are at the community level with all of us making differences in people's behaviors. And that's just one of the real key things that I want us to learn. Now, I plan to spend about 30 minutes with you with kind of slides, but 30 minutes with discussion, questions, answers. I think a lot of it will come to even more life with your questions and answers. So as I go through this, please note just some questions you'd like to ask, or if anything you hear interests you, please feel free to bring it up. There are no wrong questions. Okay, first challenge to make sure I can drive this thing. So I couldn't help but start with this slide. It's a really interesting time we find ourselves. And Dickens once famously said this back in the 1850s in London, and you all are familiar with the first part of this sentence, maybe not the last part. It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. We, as a country, can be so wise, but at the same time so foolish around what we're trying to accomplish for better health. We've gotten wound around the axle of healthcare and not wound around the axle of health. And I just really have to tell you that. I'm 38 years a family doctor. I can't believe how broken the system is. All of you, I think, at some level know that, either through your own health experiences or for those from people you love or you've been a part of their lives. You know, as smart as healthcare can be in this nation, we're just stupid in regards to really solving the basic problems. So it is about community. That's why when Karen and Jackie asked me to do this, I said I'd be more than happy to do this, because it's about education. It's about how do we get people working as a group to start to solve the issues. So this definition of community, very simply put, a unified body of individuals. We're a community in this room right now, trying to do the best for people that we engage with, our families, ourselves, in ways to make things better. I like community approaches. I don't like hand-me-down types of approaches from the federal government, and I am a fan of our country. Don't get me wrong, I served 21 years in the military, but all healthcare is local. And where the solutions for these issues are local. It's at a community level. And so when we start to talk about dialing this into the community, I'm all in. The other thing that I think it's really important for us to norm on is what is health. And this was done, this definition, by the World Health Organization, and I like the simplicity of this. But the amazing thing is it was done in 1946. So this isn't rocket science. This is just bread and butter, what is right. So health is a state of complete physical, mental, and social well-being. Let me say that again. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I really like that. What we all want is to be healthier people. Now granted, we don't want diseases or infirmity, but that's when the healthcare system starts to get involved. But so much is upstream. If you will, just imagine the tip of an iceberg. You all know that concept. What, about 10%, 8% of the iceberg sticks out of water? That's healthcare. What's underneath that is health. And we all have a stake in that, not only for the community, but for each other. So let me just ask you, as an audience, what percent of your health, as you sit here today in this room, do you think has been from the healthcare system in your life to this point? What percent do you think the healthcare system has contributed to your health as you sit here?
10%.
Okay, 10%? About 10%? Okay, good. Good, you guys are fast readers. And you're accurate. That's it. I can't tell you how many people I say that to and they think, well, the majority of my health is due to the healthcare system. No, it isn't. By far the most minimal part of your health is due to the healthcare system. And in this, as you see here, about 10% of what makes each of us healthy is due to having a healthcare system that is accessible to you. 20% from your genetics, 20% from your environment, 50% from our behaviors. And we'll talk a little bit more about that in just a second. But of course, take a look at that. That's where all the money's going, is into health care, 88%, medical services, $3.6 trillion a year in our country. Our healthcare system in the United States would make us the 6th largest world economy on the planet, just from our healthcare system. It's the largest single business in the United States. Healthcare. It's the largest, usually the largest single source of revenue in a community. You start to wrap up hospitals and doctors' offices and nursing homes and all the activities that go into the healthcare system, then you get a large system. And sadly, again, and I love our country, don't misinterpret this, but we're such a capitalistic country that we've created a healthcare system that mirrors exactly what our country does, and that's to make money, not to make health. You don't get paid as a physician or a hospital to have healthy people. You get paid to take care of them and do things to them when they're not healthy. And so part of the struggle in our nation of dealing with a broken healthcare system is to try to change the dynamic of this. We need to move upstream. We need to focus then on what it is that keeps people healthy and away from the healthcare system. So with that in mind, I just want you to know that, not that the two can't be related. Healthcare can restore health, and bad health can lead to the need for health care. So it's not that the two don't intersect, but they're two different things. When you take a look at why people die in our country or in the world, this is true across the world, 40% of deaths are due to people's behaviors. And you can intuitively get that. It could be what you eat, what you drink, how much you sleep. For me, how fast I drive in my car. It's probably the biggest risk I face. Do I put my seatbelt on? Those behaviors could actually kill me early. And I'm very mindful of it. My wife reminds me constantly, Ted, put on your seatbelt and slow down. And so it's inherent in all of us. We have behaviors that actually set us up for potentially poor health. Another one I've struggled with is sleep. The data is really clear on this. We need at least 7 hours of sleep consistently a night. If you get less than 7, magic number there, you're killing yourself. You're shortening your normal lifespan. So again, not that we can't have a night or two where we get less, but we must be in a habit of better sleep. Just as an example, again, of behaviors. 30% of deaths are due to genetics. There can be things in each of our DNAs that lead us to issues that can catch up with us. 15% from the socioeconomics, 10% from what the medical care system can either help you with or actually, in part, can harm you with. It's not like this system doesn't hurt people either. And 5% from our environment. Now, this environment piece is becoming a bigger and bigger deal. And in fact, I think the issues around climate change are huge for the world's health. Perfect example is that as the world gets warmer, we've seen different diseases start to show up in the United States that are mosquito-borne from countries and continents that we've never had those mosquitoes from. So what we saw with the West Nile virus, what we see with the return of malaria, what we see from hotter tropical climates, the Zika virus, things like that are now being reintroduced, if you will, or introduced for the first time into our country from other places because of the change in the warmth. What's happening with water, what's happening with sea level rise, what's happening within communities around this issue, what happens with weather patterns, what happens with fires, what happens with smoke in communities. All of it becomes relevant in regards to the changing environment we find ourselves in. And it's not to be underplayed. It's a big deal. Now, what's interesting is that these 3 behaviors, coupled with these 4 chronic diseases, lead to 1/2 of all the deaths in our country. Wow. Talk about boiling it down. Physical inactivity, poor nutrition, tobacco use, coupled with then their role in cancer, heart disease and stroke, pulmonary disease, diabetes, 1/2 of all the deaths in this country. I cannot tell you on a daily basis how much I see the truth in that. the interplay of these things in people's lives that lead to these issues. And so again, if you can just imagine then, what can we do to start to help with this, to again then start to change the equation? Now, true, all of us will die. There's no getting around that, at least with the knowledge we have at this point in our existence. But what we want is to lead as healthy a life as possible, as long as possible, and you get to a healthy state and plateau until death. And then you have a good death. Now, a good death is a topic for another time. But I can tell you how I want to die. And unless I get in a car accident because I'm speeding back to my office with not a seatbelt on, which I hope I can and have learned to at least change the seatbelt part of that, not so much the speeding, then how I want to die is I want to be at home. I want to be warm. I want to be dry. I want to be out of as much pain as I possibly can. I want to be surrounded by people who love me, and I want my dog on my bed. And that's how I want to pass from this world. I do not, desperately do not want to be in a hospital ICU bed with tubes in every orifice of my body, with beepers, buzzers, and bells lying semi-naked on a bed with people I don't know. That's not what I want. So just imagine if we can start to then change the equation of health and healthcare, keep us all as healthy as possible, as functional and as happy as we possibly can in our lives. We get to a natural point where death will happen, but we have the type of death we want. Now that starts to become ideal. And the amazing thing is that many countries other than ours are much better at doing this. We struggle with this for a lot of reasons. We have a healthcare system that's really geared up to try to do things to you. I cannot tell you how many people at the end of life, because of the lack of an educational approach to this concept, end up finding themselves being those patients in those hospital beds. And I know it's not what they wanted if we could have sat down and talked to them. So again, just kind of putting it in a larger context for you. Now, what you might not know, this is interesting, and this has been well studied, reported on New England Journal twice, rediscovered as being accurate. And this is what happens to 1,000 people over the course of a month. So just imagine each of us over the course of this last month, 800 will have some sort of symptoms. Just imagine yourself, have you had any healthcare-related symptoms in the last month of some sort? 327 will consider seeking medical care. 217 actually will. 65 of those to a complementary or alternative medical care provider of some sort. 21 to a hospital outpatient clinic. 14 home health care. 13 to an ER. 8 will be hospitalized. 1 will be in some sort of teaching hospital, academic hospital, one of those really fancy places. Let me ask you, knowing that that's kind of the flow of what happens with 1,000 people over the course of a given month, where do you think the majority of the $3.6 trillion is spent in our healthcare system per year? Where on this table? Okay, I'm hearing hospitals, I'm hearing this right lower quadrant. And that's exactly where it is. Now, let me ask you, what percent of 3.6 trillion do you think is spent down in these lower 3 or 4 boxes? 95%? That's really close. It's about 94, 95, 96%. Now, just imagine that. Well, actually, let me bring in one other piece of data. Where do you think the majority of the nation's medical students, nursing students that train to be physicians and nurses are trained on that graph? Those same places, right? We have perfectly created a system designed to do what our healthcare system does, and that's to take care of people when they're sick. Now just imagine, and this is what's meant when we talk about shifting healthcare to health. When we shift from this lower part up into here, this is where health resides. This is where we want to keep people as healthy as possible. We don't want them coming here. So when we talk about shifting upstream, we're talking about moving upstream here and focusing a lot of our efforts there. Just makes intuitive sense. So what I've seen really happen with our nation, and I think we're the best in the world at this, is that we've become a massive fire department. We've gotten really good at putting out people when they start on fire. When their diabetes gets out of control, when they have a stroke, when they have a heart attack, when their hypertension, which could have been controlled for pennies on the dollar, and their diabetes pennies on the dollar, access to timely mental health care or oral health care for pennies on the dollar, translate then into tens of thousands to hundreds of thousands to millions to trillions of dollars downstream. I, for one, am a passionate advocate of changing what we're doing and driving further upstream. It's our obligation to our fellow citizens and what we're trying to accomplish as a nation. And we should be better at doing this. I love this quote by Einstein. Doing the same thing over and over again and expecting different results is the definition of insanity. We are insane in our approach to the healthcare system. That's why you've seen so much political turmoil about this. It was a huge deal in the 2008 election, in the 2012 election, in the 2016 election. It will again in the 2020 election, and it will be for the next 50 years in our country as we start to try to grasp with this concept and start to change it. Now, this is a real aha for me, but probably intuitive to you now from what we're talking about. And that is that your zip code, or a patient's or a person's zip code, is more important to their health than their genetic code. Now, to me, that's a real problem. We live in a nation like ours, the richest nation on the history of the planet, in the history of the world. There has never been this much revenue generated by any single country in amount ever in the history. Yet we are absolutely surrounded, even right here in our communities, by the haves and the have-nots. It's unbelievable to me that we can't do a better job of making sure everybody is healthier, and that should be a focus. Why shouldn't it? It shouldn't be about others getting more than others. It should be by doing enough to make sure everybody has enough. So it's a concept in our own communities. I can point out by zip code, by socioeconomic status, higher disease-bearing peoples and groups than others. Mental health, asthma, heart failure, stroke, diabetes, mental illness than other parts of our community. And so the combination of one's zip code, where one lives, and one's educational level is a greater long-term predictor to people's health than anything the healthcare system does. That is an amazing thing. So again, when we talk at forums like this, and we start to norm about, okay, what can we as a community start to do to make a difference? This is why I'm all in. It's going to happen with groups like this. Groups that care, groups that start through each of us as individuals making our changes in our spheres of influence that start to adjust this. Changes within ourselves that starts to adjust this. Now, this concept of the social determinants, it's important. There are many of them, probably well over 24. But such things as food security, insecurity, housing, transportation, utilities issues, daycare issues. I mean, just think about that. If you're living at minimum wage at $7.25 and you're trying to work one, maybe two jobs to pay for housing, food in your community, and daycare is costing you 3/4 of your paycheck, how does that math work out? Legal issues, employment issues, education issues, substance abuse, safety, domestic violence, healthcare literacy is a social determinant. Access to primary care is a social determinant. I can go through community by community in this community and in our state and show you where these are problems. And again, what is the solution? That we do nothing, that we wait for people to start on fire, and then they enter into our hospitals where we try to put them out? Or do we all collectively start to move upstream? 80% of my colleagues say that social needs are directly related to medical conditions. They say also that they're not confident in their capacity to address them, nor their time to address them. And that unmet social needs leads to worse health for everyone, not just those in low-income communities. Why? Because the health of people and the healthcare costs get passed on to all of us. They get passed on in higher premiums for insurance. If you're an employer and we have a self-funded insurance plan for my 350 employees, I look at higher premiums. It all gets passed on. So again, we're all in this common pool. What can we start to do with this? Now, we surveyed our patients. This is back through the time period 2016, 2018, and we surveyed them. Now, we're an FQHC system, the Family Medicine Residency of Idaho. We do business as the Family Medicine Health Center. We have 9 locations now in both Ada and Canyon counties. And we surveyed our patients for these social determinants. What sorts of things also exist in their lives in addition to diabetes and hypertension and mental illness and all the routine things they come in to see us for. And I've got a table that we'll take a look at in the next slide, but I just wanted you to get a sense of all the issues that are impacting people's lives. A lot of stuff. So this table kind of breaks that out a bit. The ability to have timely access to health care. That's why I say it's kind of a sleeper as a social determinant. But if you can't afford it, then you live sicker and you die younger. That's just the way it is. By the way, do you know that of all the industrialized nations, the United States has the lowest life expectancy? The lowest. We spend the most, we have the lowest. And what's even taken us lower recently, and I don't know how many of you saw this, just kind of published data last 2 weeks, is that we have the fastest rising death rate in those between 30 and 54 years of age.
Yes.
Suicide, homicide, opioid addiction, drug-related deaths. It's unbelievable. We have such a stressful society. A society where we just are a bit out of control. It all kind of starts to add up. Issues with food security, insecurity, in our population, 19% of our patients, 1 in every 5 of our patients. The national average is 1 in every 8. 1 in every 5 of our people, of our patients, right here Ada, Canyon County, food insecure. Our neighbors, people we work with, people working in the restaurants, all of them. Now, I'm preaching to the choir, to you all. You know that. You see this. Access to medications, 17%. Dental issues. It's amazing to me. I was being served in one of our restaurants recently. Nice young waitress started talking around health and healthcare issues. She was suffering from chronic migraines, didn't have the resources to go in and have it seen. Felt for her, how it played out with, could she hold this job or not? And at the end of our conversation, she smiled and had a left front tooth that was totally decayed. That's not going to get helped. She doesn't have the resources to get that helped. Right here, Boise, Idaho, one of our restaurants. Housing, utilities, education, exercise, transportation, employment and job training, you get it. Those are all the issues that start to impact people in terms of what's going on. All part of a complex story. So how we get to the food insecure question, and we ask every single patient that walks through our door. We have 35,000 patients. They constitute about 125,000 visits each year. As they come through, part of the check-in process for them is we ask these two basic questions. Within the past 12 months, were you worried whether your food would run out before you got money to buy more? So this is a worry about not having enough resource to buy food. The second one is within the past 12 months, how often did that happen? You just didn't have money to make sure you had enough food. Now, I don't know about you, but I've never worried about that except when I was in college. I was on food stamps, and I was grateful for it. I can't believe how poor I was at that point. And I was thankful that there was something to kind of help me through. But ever since that time, I've really kind of gotten away from the recognition of how impactful this can be on people's lives in regards to this. Hence, one of the important reasons that we're in the room today. It used to be, this will be an insight moment for you, I think. It used to be that as physicians, we could tell someone's social economic condition and their socioeconomic status by their teeth. Those without resources couldn't get dental conditions fixed. They had teeth like the waitress I shared with you. And now it's by body habitus. Why? Because they can't afford the right food. If you're poor and you're living on a fixed income and you're food insecure, you're going to eat anything you can. And the cheapest food is the least valuable food. Yep, it's high in calorie. Yep, it's high in sugar. Yep, it feeds you. Yep, it keeps you alive. But trust me when I tell you, it's eroding your body as well. Now, I don't know how many of you have ever read the book Sugar Wars, but unbelievable. As much was known about the destruction of sugar back in the 50s and 60s as was known about cigarettes. And the two industries went to war with each other about who was going to get brought up to the nation and held up as the bad actor. And the sugar industry won. And the tobacco industry lost and got thrown under the bus. So in 1964, the Surgeon General put up as the poster child of bad health, tobacco, not sugar. Just as much of a problem, still is. We're recognizing it now. We all grew up in that era. I loved sugar. We all did. We all got addicted to it in many ways. And again, it pays a price. And how it plays out now in modern society is by extra weight. As deleterious to our health as smoking. World's most preventable healthcare problem, smoking still. Second, obesity. So when we talk about, again, collectively our behaviors and what we can start to do to educate, what we can start to do to change the trajectory then of people's health, this is why these things are important. Couple closing thoughts with you, and we'll open it up for questions. What I do for a daily living is to try to help integrate people's health care so that we're working upstream around social determinants and connecting them with community resources, so we're dealing with more than diabetes, hypertension, depression. We're starting to take a look at the other aspects that, as you've heard, are more important to their health than what I'm writing them for medication. Healthcare is a team sport. We must start to get into health as a team sport. This whole concept of the medical home neighborhood and the patient-centered medical home was a delivery model change, a transformation to start to help us address at a primary care level, what is it that we're trying to collectively do to be responsible and accountable for people in regards to this. Helping employ community health workers, helping use social workers and psychologists at the point of care to help with behavioral issues as well as medical issues, helping people with their healthcare literacy, helping people through motivational interviewing with their behaviors. It doesn't help if I can know exactly what to do with their prescriptions for lisinopril for their hypertension or for insulin for their diabetes, if I don't do anything to help them with their knowledge of eating that helps control that. I have patients that can out-eat any medication I put them on. And I don't mean that facetiously. It's just the truth. And I think I've done a good job. Why? Because I've treated them for their hypertension. But I've missed the big picture of what it is that's really going to make a difference in their outcome, and that's the behavior they have around salt intake and eating and exercising and lack thereof. So I kind of see the community approach as kind of like this. We're all part of a team. We're all in this together for the best outcome for our community. And you have all been privileged to sit and listen to a symphony that's playing beautiful music. That is unbelievable. But you've all heard them in their warm-up too, when they're not on the same sheet of music. And it's just, you know, a gluttony of sound, right? It's discordant, it's uncoordinated. Can you just imagine if this team isn't on the same wave page of their music? It's horrible. We've got the best, I think, physicians and healthcare system on the planet. Hospitals, all the parts. But as a system, we're not on the same page. As a system, we suck. And again, what we need to start to do, and this is why opportunities like this, opportunities to start to work across the silos, outside of health care, into the community, into different agencies that have key impacts on health, starts to produce this in a positive way. We all start to get normed on what we're trying to accomplish for health. So, what can you do, sitting here, what can you do to improve your health? So here is kind of Ted's top 10. Now, there are other things that could be on this list. Increase your activity. If there was one thing I could say will help your life the most, both in terms of your longevity, the quality of your life, the length that you will be independent in your life without help from others, and happiest, it will be to exercise. If I could develop a pill to do that, I'd make $1 billion a year. But we can do it, all of us. I've got my little pedometer. I'm sure many of you do too. I work religiously towards trying to get at least 10,000 steps in a day. It's really important for me. And you know what? It's helped me with my happiness. I can get to be a pretty intense sort of guy sometimes. Exercising for me helps me relax. It helps me see that bigger picture. Number 2, watch what you eat. Boy, we all can do better at that. One of the key things I've run across is that one of the best things you can do to control your weight is don't eat anything after 7 p.m. at night. Your body needs about a 12-hour period of no food intake to regulate its own metabolism. I, like so many males in our society, boy, you may not eat much during the day, but look out at night and you're shoveling stuff in. Nothing after 7 p.m. Try to set up your eating cycles in ways in which you can do that. Number 3, watch your weight. It's important. Trust me, I try to watch mine. It's a lifelong kind of struggle to be at an ideal body weight. Number 4, don't smoke or use illegal drugs. Probably most of you don't do that. That wasn't the norm when we were growing up as kids. It's just the way it was. My mom tells me about when she went to college and they were handed free cigarettes, you know, and it became a sorority thing to do. You weren't cool if you weren't smoking. Same with vaping now. It's a big deal. Number 5, get sleep. 7 hours at least. I've commented on that. It's a priority. Number 6, get immunizations. Now, I know there's a whole debate about this, sadly. Trust me when I tell you, the medical evidence squarely stands behind the need for immunizations. There have been 2 things and 2 things alone that have increased life expectancy in our country from 1900 to today, that's added from the average life expectancy of 47 years of life in 1900 to what it is now. Still the lowest in the world, but it's still like at 74 years. Number 1, purification of water. Number 2, immunizations. This isn't a fad in terms of this is good for you. I understand all of the discussions around autism and all those other things, and I respect where people are at. But from a population health perspective, immunizations are good. Control your stress. However you do that, however you find that. I like to use the example of a guitar string. We all need a certain amount of stress, just like tightening of tension on a guitar string to play a beautiful note. But it can't be too tight. Too tight and it pops. If it's not tight enough, there's no note at all. So it's okay to have some degree of stress. We all do, that's life. But control how much that is. Be aware of it. Stay hydrated. One of the things we do poorly as human beings is drink enough water. So there's another health tip. For your maximal function, stay hydrated. Number 9, watch alcohol use. It can sneak up on all of us. For women, 1 drink a day. It's 4 ounces of wine, 1 bottle of beer, 1 1-ounce hard drink. That's okay. Men, 2 drinks a day. And it's not that we can't on occasion have a bit more, but you must be careful around alcohol. It's one of the biggest elephants in our community in regards to what hurts people. And lastly, I had to throw this one up. Get a pet. For any pet owners, you know exactly what I mean. It is unbelievable in terms of just the stress reduction that can happen with a pet that loves you and you love and you can go on a walk with, and I have seen it make huge differences in people's lives. There's reasons that nursing homes are starting to add pets in the nursing homes for people. It's just one of those things that is a comfort item that really can help, again, I think, with the stress level. Oops, shouldn't have done that. Okay, just a couple more. So what can we do to improve the community's health now? I just talked about what individually we can do. Number one, get people health insurance. The issue around coverage becomes an important thing. When you get covered, then you can start to drive people upstream towards better health versus just reacting to when they're on fire, especially if they have no coverage, which then becomes the largest bankrupting influence in the United States, is people's health care costs. So get people covered. Dental, health care, timely access. Start to get things under control. Start to move them upstream. No country on this planet that's industrialized has the uninsurance problem that the United States does. In 2008, we were at 52 million uninsured people. That's greater than 20 states' worth of population. We still are at about 24 million. That's a lot. Medicaid expansion in our state was the single most important thing the state could do for the state's health. I know that sounds funny and probably not true in comparison to what we could do with people's behaviors. That is one single thing for the best health of the state, coverage for people that didn't have it, single most important thing we could do. Having a usual source of care, that's a big deal. Why? Because you have a place to go that knows you. Not dissimilar to a barber or a car mechanic that you trust. Trust with a provider in healthcare becomes important to you because they then start to work with you as equals around choice and starting to help you with behaviors as well. Start measuring healthcare outcomes. We need to do a better job with this towards pounds of food, as Karen was talking about, and what are the outcomes for people's health in our communities. Pay attention to the social determinants, increase physical activity. You've heard me say that. Ensure safe water and nutritious food, immunizations writ large. You know, measles is the canary in the coal mine. When population immunization rates fall below about 93% of the population, measles starts to show up. And we're seeing that play out. We have pockets in Idaho that are in the 40s. Pockets in Idaho, same communities, in which measles is appearing. That's a problem. So again, we just need to be mindful of it. Avoid smoking and excessive alcohol use. We talked about tobacco legislation quite a bit now, both at the state and the federal level, around raising the age to 21. Huge. Why? Because kids that start smoking, kids that start vaping, leads to a lifelong pattern. And lastly, get engaged in improving community health. Hence, again, why we're here. If you want to go fast, you go alone. If you want to go far, you go together. That's why it's important that we have talks like this, so we start to norm around what we can do together. I've really always been struck by this quote from Darwin, next to my last slide. It's not the strongest of the species that survives, not the fastest, it's not the most intelligent. It's the one that's most adaptable to change. We must create an environment in which people can be restored to as much health as they can have, to be as adaptable as they can in their environments. that give them the best opportunity for their healths. And lastly, Winston Churchill once gave the shortest speech in political history. He was in front of the English people in 1944. The Nazis were bombing London nightly. The people were dispirited, demoralized. They were just waiting for the Nazis to walk across the English Channel, take over Great Britain. And he stood up and he said those words: never, never, never give up. And he sat down. And I don't think we should ever, ever, ever give up on trying to do the right thing around health and helping people be as healthy as they can. Why? Because it maximizes the potential in our society. Why? Because we become a better nation for it. Why? Because we become a better community for it. Why? Because people live happier, longer, more productive lives because of it. And that should be our solemn commitment to each other to try to do what we're talking about here. And that is why I'm here now. I appreciate Karen asking me and Jackie asking me to come. I'd like to stop and open it up to questions for you. I'm sure I've provoked several in many of your minds. Happy to try to be able to answer them to the best of my ability. Thank you for your attention. Yes, ma'am.
My name is Joanne, Dr. Epperly.
Hi, Joanne.
In your statement that you have 350 employees, right? You said.
Yes.
And then you go through an education program with them. Is that correct? Or when you treat them, you also try to educate them as far as what their better health would be. What is your success rate on that?
Yeah. So the question, in case you couldn't hear it in the back, was looking at the FMRI, my organization, and our 350 employees, what are we trying to do with our self-funded health insurance? Number one, trying to give everybody a good insurance plan first that covers not only medical, but also dental, visual, behavioral. Number two is that, and we try to do that with good premium costs so that we're not pricing people out of that. And as an employer, I feel really important to do that. Number three is that we work with all of our patients about making sure they have a usual source of care. Again, that's important on the primary care facing side of this, because if they do, then they're not bouncing around loose in the system like a pinball might, racking up different amounts of visits and dollars and uncoordinated care in the system. Fourth, to your point now, is that we then proactively educate them all about how best to use the system, both around health, dental, vision, but also around healthy behaviors. I, from time to time, you can imagine from seeing me do this talk to them about what are the top behaviors that we all are responsible for that will help us be healthier people, so that we engage in the conversation. In fact, some of them, I'm sure, probably roll their eyes. Oh God, here comes Ted again, talking about sleep. But it's one of those things that it makes a difference. So, Joanne, those are the sorts of things we do internal to our organization to help with this. Now, the outcomes of that is we've seen self-funded plan, we've seen drops in health insurance costs every year for the last 7 straight years. I'd like to say our people are healthier. We do track steps, weight. We do track outcomes in terms of compliance on medication, control of hypertension, things like that. We do track all of that. I can tell you that we've done better as an organization in terms of moving my small group of 350 people towards better health. Now, I'll also tell you that there's still things that happen to people. Cancers happen, motor vehicle accidents happen. Those things are part of life. In our insurance plan, we have a reinsurance so that if anybody goes over $110,000 of combined medical costs in a year, then the reinsurance picks that up so that the organization doesn't go bankrupt on a $3 million premature delivery at 24 weeks. So that's kind of how many self-funded will go about things. But yes, we made differences in our own organization. And I was really keen on doing this as the CEO. I said, you know, let's walk the talk. If we expect that we're going to try to do something to change the community's health, why can't we start with ourselves? It's that Gandhi quote, be the change you want to see. Well, if we can't walk the talk, how can I expect anybody else to do that? So that's kind of what we did. Thank you for the question.
Thank you.
Yep. Okay. Other questions? Yes, ma'am.
Dr. Epperly, thank you. It's
Yeah.
always a joy to hear you speak. One of the slides that you had were the resources listed, and the bottom 6 had 0% from your
Yes.
patients. Does that mean that those don't impact them?
Yeah, that's a great question. So back on the list of social determinants we had for the 2016-2018 timeframe we were asking, and this was a pool of about 800 patients. Those at that time didn't make the list. Those are important issues, though. They just, none of the 800 indicated that. There was one at the very bottom, and very perceptive of you to pick that up, that I want to comment on. And the very bottom of that list, number 24, was social isolation. At that time, with our population, nobody mentioned social isolation. But let me tell you, social isolation is a big deal, especially for the elderly. And social isolation in the elderly can really impact their health. And so trying to make sure, that's why a usual source of care can be useful. If you know the patient well, then you can either through phone calls, text messages, Zoom, home visits, drop in and see how they're doing. On the Isle of Jersey, and the Isle of Jersey, I'm sure most of you won't know where that is. It's in the English Channel between England and France. The Isle of Jersey is a small little country. And what they did on that island was incredible towards this issue of social isolation. They had an aging population of elderly people living alone, many elderly women living alone. Their husbands had died earlier. And they were finding that health of these people were dropping a lot. And as opposed to waiting for them to come into the healthcare system on fire, what they did is, because of technology, they saw that the amount of mail deliveries through regular mail was declining. So what the healthcare system on the Isle of Jersey did, 64,000 people, is they got the postmen to check in every day with these elderly people. What a brilliant idea. They knocked on the doors, they checked with Mrs. Smith. How you doing, Mrs. Smith? They got to know each other because they had been their postman. Yeah, I need this couch moved today, would you mind? They did. How you doing with your medication? They were instructed what things to ask about. They did kind of a status check on Mrs. Smith. They'd drop a quick note to the physician. Saw Mrs. Smith today, looking good, had an issue with this, and that improved the health of the people on the island. Now just think about that. That's starting to, again, think out of the box on not just waiting for people to come into our traditional healthcare system, but starting to leverage community resources in a way that starts to take care of people's health. So those at the bottom of our list there just weren't indicated at that time. If we had a larger sample, maybe a different age group for the people, the 800 that filled that out, we would have saw some of those other social determinants come out. If we did it today, maybe some of those would have changed. I want to mention one thing that has changed from our study of 2016-18, and that's the impact of housing. So we're finding tremendously increased homelessness starting to happen in our community. What's happening is home rates are going up, pricing, especially the elderly, fixed incomes, out of their homes. They can't afford it. The tax they're paying on fixed incomes are forcing them out of their homes. What we're seeing is a trend that's taking people from their homes into their cars, from their cars into a friend's house as a temporary, and then onto the streets. That's horrible. And it's a major issue. So one of the things that I would say to you, again, from a social determinants perspective that we've seen just in the last couple years since we did this, was the impact on homelessness because of elevating house prices on fixed incomes. We've still not fixed our minimum wage at $7.25. And so how we're seeing that play out is couples working 1, 2, and even 3 jobs each to try to make a living wage. Things have to change in these regards. When I take a look at politics and policy, we must get to a place where we're not causing worse health because of our lack of politics informing good policy. And again, I don't mean to get political here at all, but it's an important interface that plays out in the health arena on a daily basis. So thanks for that question. Other questions? Sure. I don't see any other hands, Joanna. Yep.
Excuse me, my throat. In your statement about those who commit suicide,
Yes.
I mean, and it's general knowledge that Idaho is one of the highest. And I'm sure there's a lot of reasons for that. And we have a lot of veterans that I think I have a nephew that almost went through that because of PTSD. And the age group that you mentioned, there is so much tied to nutrition and depression. And so, and alleviating depression sometimes has to do with somebody's diet, as that we become aware of. So in this particular age range, is there any indication about their lifestyle behaviors that might have been improved by their changing their diets or anything like that into bringing them into a better place where they're not happy?
Yeah.
On the internet the other day, I saw this is the stupidest state. Well, out of curiosity, I looked at it and it said Idaho.
Well.
And I thought, if I was depressed, and then I went to that, and I think, well, I'm stupid anyway. Maybe that would be my thought if I were depressed anyway.
Right.
But this bothers a lot of people. I know myself that our state is known for its suicide rate, and maybe being the stupidest state. And then we have this national average of people that commit suicide in this age range. And I was just wondering if you feel that nutrition or anything has a lot to do with this suicide rate.
Sure. So the question writ large for everybody was, Idaho ranks towards the highest in suicide rate. We've talked about a lot of social determinants. How does this all kind of intersect? And I would say to you that, again, as I mentioned earlier, I was born and raised in Idaho. I think I know our state pretty well. It gets back to how Idaho got settled. In many ways. We had rugged individualists come to this state that didn't want to live in the East. They wanted to get away from federal government. They wanted to come out where they had land and space. Many of them were miners and loggers. And they didn't want anybody telling them what to do, right? So just imagine, now we've had other people move into the state, of course, over time, but that in some ways has become the culture of our state. And how that then starts to play out in regards to health, hard living, hard drinking, hard smoking, inability to say to people, I'm hurting, I'm troubled, I have problems with depression. Stigmas. In a state that also couples one of the highest in the nation density of handguns and firearms. You put that together and then throw some alcohol on top of that, and you get kind of this toxic brew. And I think in many ways there's a lot to all of that. So to your question now, which is what can we do in regards to some of these issues to start to make differences? And I think it is back to better education around resources, around understanding what's making people tick, starting to educate, starting to have a usual source of care again, so that they know that there's resources that can start to intervene. You've probably heard this, but 50% of all patients that commit suicide were seen within 1 month by some sort of healthcare provider. It wasn't necessary for depression or some sort of behavior of, I'm going to commit suicide. But there was a touch in the system that might have picked it up. So just as I showed you our 2-question screen for food insecurity, we have a 2-question screen around depression. Why? For just this issue. If we can know that somebody is not in a good place, we can spend just that moment of time to say, hey, Bob, tell me about this. I see here from the screen that you're not feeling really hopeful about the future. I can't tell you how many people we've saved from killing themselves, but I can almost guarantee it's probably in the hundreds. And so again, it starts with the design of the system, being mindful about it, starting to think about resources for it, starting to educate around it. It's a tough problem, but it's going to take, again, a community solution. So thanks, Joanna, for that question as well. Yes, Jack.
Add on to that, Dr. Epperly. So one of the first partnerships that the Idaho Food Bank engaged with regarding just healthcare partnerships in general was started by one of our AmeriCorps Vista members. She was a member of the food bank as the AmeriCorps Vista person and helped us start in the healthcare area. But Marjorie was also volunteering at the Idaho Suicide Prevention Hotline.
Yes.
And saw a natural connection. So right now, the Idaho Suicide Prevention Hotline, when someone is calling in with a mental health emergency, they are asking, have you had access to food? When's the last time you ate? Because, you know, if you aren't getting access to food on a regular and ongoing basis, we know that that can lead to some depression, that can lead to some anxiety. There's already enough stress around what goes into not having that access to the food that you need on a regular basis. So they are screening for food security, and they do have access to our entire resource list. So no matter where they're calling, where the patient is calling from across the state, that person can say, have you had access to food, and are you aware here are some access points for you for a local food pantry, a local meal site? I mean, not that that's going to solve everything, but it's still one access point to try to break down some of those declines.
Yeah, thank you for that, Jackie. There were 2 points in there I really want to underscore, and that is the link between nutrition and or depression. The second is around the suicide hotline as a resource, an educational resource, again, for people to reach out to. We were the last state in the United States to put in a suicide hotline. I'm thankful Idaho did that. Again, I'm sure it saved countless numbers of lives. So I'm glad for that. One other thing that I just bring up to you and we've got about 3 minutes left, is I've talked a lot about what you can do, what we can do, what health and healthcare can do, but what about the patients? What about the people? I think the most underutilized resource in all of health and healthcare is the person themselves. And we need to engage them better. I think engaged people will be the solution. We just need to engage them. So many don't know that there are resources. So many don't know where to reach out to. So many don't know what can be done maybe to help themselves. So I think understanding, and that's why the relationship becomes important we all have with each other. Helping people understand that there are other options and resources becomes really important to them. And that's why if we all are out there doing what we can, making relationships, making differences known, having resources, plugging people into things, that's the best way through all of this. And hopefully, again, and we're in the midst of this in the healthcare system writ large, and that is starting to change how the payment system for healthcare works. so that the focus is not on seeing people and doing things to them, the old fee-for-service system, see one, do one, treat one, bill one, but to have a different system where there is a global payment to organizations to then work on behalf of all of their patients in a way that starts to keep them healthy. And I'll end with this concept. The idea we're working for in the future is to have nobody in my waiting room because they're healthy. And so the system needs to change so that technology helps us do that. We engage people around their behaviors. They start to track their own behaviors. It all flows into the electronic medical record through biowearables, blood pressure, weights, peak flows on asthma or COPD monitors, blood sugars for diabetics. You can just imagine technology starting to do this. Imagine on my electronic medical record. We have 35,000 patients, all arrayed by the types of diseases they have. By each disease category, there's a list of patients that are green, yellow, and red on the computer. The people that are green get proactive education sent out by us to keep them healthy, to keep them encouraged, to keep them motivated, to touch them. The people that are yellow get a phone call from our nurse or our MA, Mrs. Smith, I've noticed you've gained 3 pounds. We know you have heart failure. Just want to touch base with you, see what's going on. Oh, gee, I'm so sorry. Last night was my birthday. I had a big ham dinner. We had extra salt. You know, aha, got it. Why don't you take 20 milligrams of Lasix? Let's help with some of that weight. Keep putting your weights in. We'll keep an eye on you. Those that are red, they come up red. We see that day. Those people need to be seen that day. 1, we can help them avoid a hospitalization. 2, we can help avoid them going to the emergency room. We take care of 35,000 people. We're keeping them healthy. Those that are yellow, we're proactively interfacing in ways other than seeing them. Those that are red, those 43 patients out of 35,000 that need it that day have been identified. Just imagine that. Our payment system as it's now constructed couldn't afford that. You'd go broke as a practice doing that. You couldn't pay overhead. So the payment system has to evolve, and it is in evolution around then quality outcome payments, shared savings, where the shared savings goes back to the primary care clinical practices to keep people healthy, to keep them out of the emergency room, to keep them out of the hospital, to have capitation payments per member per month so that you can have a team of people starting to work together to do this. That's what other nations have done. That's tough for America. Why? Because it's a $3.6 trillion industry. And to change how $3.6 trillion of money flows is a huge deal. But all the things we're talking about is exactly why, and it's how it starts to get done. This is not a short journey. This will take 50 years to get right for our nation. But it starts with meetings like this. It starts with our awareness. It starts with our attitudes. It starts with what we can do, not only for ourselves, but for our families and for our communities. So with that, I'm going to stop. I really appreciate your attention. Thank you. Have a great rest of your day and a great holiday season.
Thank you.